You are listening to Why I Vaccinate. I'm Ann Thomas. I am here with my co-host, Veronica McNally, and we now say hello to Dr. Matthew Denenberg. He is a pediatric emergency medicine expert with the Helen Devos Children's Hospital. Dr. Denenberg, thank you so much for your time today.
My pleasure. Thank you for having me.
And Veronica, as we continue this conversation about building community immunity, I'm going to turn this over to you to start the questioning with Dr. Denenberg about keeping children safe, keeping all of us safe during this rather difficult time.
Dr. Denenberg, it's so great to talk to you today. Why don't we start by having you explain the difference between a pediatric emergency room and just a general emergency room?
Yeah, sure. There's always a little bit of confusion with that. The general emergency room is an emergency department or emergency room that's within a general hospital. So most emergency departments in the United States are general emergency rooms. They take care of anybody from all ages, all conditions, and there are about 2,000 of them across the country. Almost every hospital has an emergency room. A pediatric emergency room is an emergency room that's specialized in the care of children, has providers, physicians, nursing staff, ancillary staff, equipment, supplies. The environment is developed to care for children. As you can imagine, children require have different illnesses, have different needs, and so they're specialized for children. That's the big difference.
And in your practice over the years, have you seen children who have become infected with vaccine-preventable diseases?
Yes, I've been doing this long enough, for over 20 years. I unfortunately, when I was younger, would see children who would be very sick with Haemophilus influenza, which is a disease that caused meningitis and caused high mortality and death and disability. And we've essentially eliminated that disease in this country from vaccination. So I've taken care of the extreme of those serious illness. I have taken care of children in my career with whooping cough. I've taken care of kids with COVID. I've taken care of kids with flu. I even have taken care of kids with TB when I was earlier in my career. So lots of opportunity to stop preventable diseases.
So we've seen with the pandemic that, especially early on in the pandemic, that people stayed home. They didn't take their kids out to their well visits, and as a result, some of the vaccination rates have dropped in Michigan. Does that concern you?
That's one of the things that's really concerning us. In fact, we had a conversation with state leadership last week. Michigan was making some inroads. We were up over 70% for most of our important childhood vaccinations. Through about 2018, we had really worked hard to get to that level over the last decade. And we're seeing that drop for the first time in almost a decade, below 70%. And we think it's a combination, you touched on it, a combination of children not seeing their primary care physicians, their pediatricians and family practitioners during COVID. And the previous caller touched on this. I think the vaccine hesitancy from COVID is bleeding over, carrying over with other important childhood vaccinations like pertussis and measles and rubella and flu. So
when you have someone who presents in the emergency room and I would have to imagine as a part of the counseling, you may have had some conversations about vaccine hesitancy. What do you tell these parents?
It's a challenge in the emergency department because they're usually in the emergency room for seeking care for some other condition. So we want to be really careful that we're taking care of what ails them while they're there. But we do try and educate. We offer the vaccine in the emergency department. We offer education on why it's important, the safety factor of it. The need to get, to 90% or 85 or 90% coverage for the sake of the community. But we don't push it to the point of making them feel guilty. We do our best, but it's unfortunate. We're still only hovering around 50% vaccination rate for children in the state of Michigan for COVID, and even less than that for the younger children.
I know Ann has some questions, so after this, I'm gonna have her ask her questions. But in terms of impact, community impact, what can you tell us about the reason why it's so important for the vaccination rates to stay high?
For two reasons. One is we know that children carry COVID, and they carry it to highly vulnerable people. So people that have immune disease, people that have complex medical illnesses, elderly, grandma and grandpa. You go to visit grandma and grandpa, and you may, as a child, may not be sick with COVID, but carrying it. So if you're vaccinated, your risk of carrying it is lower. And the other is, as we see more and more variants over the next period of time, we don't know whether the fact that kids don't get particularly sick with it at high numbers right now is going to hold true in the future. And so as more kids can carry the virus, it allows it to mutate even more. And we just worry that one of these mutations or one of these variants is going to infect kids in a more in a worse way than it does now. And then we're going to look back on it and wish we had pushed vaccines even more. So.
And Dr. Denenberg, even though we would all like to wish COVID away, it's still here, and we still have to deal with it until further notice. How do we protect our little ones that cannot yet get vaccinated? What should we be doing right now to protect them from getting it?
Yeah, I actually think one of the most important things that we need to do is what we've probably should have been doing and have done for things like flu and respiratory season for years. Children of a younger age, if somebody's sick or ill, they shouldn't be around them. If the COVID numbers start going up and our local and regional and state public health agencies do things like mask mandates or encourage social distancing, that applies to the little ones too. I just think we have to, keep them away from people that are sick. And when the little ones get sick, keep them away from other people. It's the old adage, when you have the cold, stay away from others. And that's about all we can do and for the little kids right now until the vaccine gets approved in that age group, which we're hoping will happen in the near future.
Now, there's still a lot of misinformation out there, and I think a lot of parents are confused. What do you say to parents who come to you? Because frankly, if I had a young child right now, you'd be the person that I would get the advice from. You're the expert. You see this all the time. What do you say to people who really are confused and might come to you with a lot of misinformation?
We try and present the facts as best we can in a way that they'll understand the safety of the vaccine, the billions of doses that have been given around the world, the large number of doses in children, the low complication rate from the vaccine. And also the data shows that if you're vaccinated and you get COVID, you get less severe COVID. You stay out of the hospital. You're less likely to end up on a ventilator. You're less likely to die. The other thing that we haven't talked about is, the multi-inflammatory condition that kids get, MIS-C, which if you can't get that if you don't get COVID. So if we can prevent kids from getting COVID, they aren't going to get MIS-C. And we've had about 287 deaths or 287 cases in Michigan since the start of the pandemic, with about 188 of those kids ending up in an ICU. And so we don't know what the long-term effects are going to be on those kids that get MIS-C. And so again, that's another thing, is if we can, help parents realize that by preventing COVID, we prevent MIS-C and other potential sequelae in the future. Sometimes that helps. And sometimes they just need to hear from their primary care physician. We really do believe primary care physicians, your pediatrician, your family practitioner, your nurse practitioner or physician assistant are the key to the vaccinations in Michigan. We've got to get pediatricians talking to their patients and talking to their patients' families.
And at the moment, do you really see big time side effects from the vaccine for children?
Almost none. There's almost been no side effects. It's been an incredibly safe vaccine, and compared to other vaccines through history, it's been amazing. The side effects have been, almost non-reported.
Well, that's great to hear. Dr. Matthew Denenberg, Pediatric Emergency Medicine Doctor with the Helen Devos Children's Hospital. Thank you for the great advice and your expertise and for joining us today. We really appreciate it.
Thank you.
You are listening to Why I Vaccinate. Stay with us. We'll be back right after this.